now when patients' expectations are higher and higher, and rightly so, because we've got the technology to be able to, or to allow us to see in 3 dimensions, we need to start using it more and more. I find that, you know, I teach a lot, and we teach a lot about, you know, a 3-dimensional root canal and how something looks in 3 dimensions, and all of our images, everything that we're doing is in 2 dimensions with radiographs, and we miss that 3rd dimension so much. Root curvatures, we talk about, especially in endo, where, you know, preoperatively we're taking 2, or we can take 2 initial pre-op x-rays at different angles to try and assess morphology, but actually you could take 1 CBCT and get so much more information. And I think that, you know, when you look at the 3D scan and the way that Vatech render it, especially on the endo mode, you can actually see those curvatures. And I've used other software where it's difficult to see what the tooth looks like in 3 dimensions and have a 3D copy of it. And I find that a 3D copy of it, especially if you're not used to reading CBCT scans, is so valuable, because it instantly gives you an idea of the difficulties that you're going to encounter. And I think for, you know, a general practitioner, sometimes being able to evaluate that before you go in for treatment means that you avoid wasting your time, wasting the patient's time, and frustration.